Dana Rebick is here now with the latest. Dana.
Well, Ben and Lourdes, this plan is still subject to FDA evaluation and a CDC advisory panel review. But given the approval for immunocompromised people to receive these boosters right now, health experts are expecting this to go through.
Our approach on booster shots is simple, and it's consistent with our approach on every other front of this war. Be guided by the science, and always, always stay one step ahead of the virus.
And to do so, today, U.S. health officials announced plans to give vaccinated Americans a third Pfizer or Moderna shot. The booster doses would come 8 months after people got their second shot, the rollout starting the week of September 20th.
When we see data that is giving us essentially indications that protection is starting to diminish in terms of mild, moderate disease, when we recognize that if this trajectory continues, that people who are well protected today may see more vulnerability in the future, we have to act.
According to a Mayo Clinic study that looked at data from 80,000 vaccinated people through mid-July, Pfizer's efficacy against infection dropped from 76% to 42%, and Moderna from 86% to 76%. Another CDC study found that COVID-19 infection among nursing home residents started to rise, vaccine efficacy declining from 75% in March to 53% in August. Protection against severe illness and hospitalization remains high, though. Health officials worry over time that protection could wane as well. Some experts have expressed concern that calling for boosters would undermine the public health message and reinforce vaccine hesitancy. Dr. Richard Novak, chief of infectious diseases at UIC.
I think we have pretty good evidence that it's safe. I think people who are worried about fear of putting a vaccine in their body should be much more concerned about putting the Delta variant into their body, because they're going to get very sick and they may end up dying of the disease.
Top scientists at the World Health Organization objected to the plan, saying poor countries aren't getting enough vaccines for first doses. But the U.S. Surgeon General says that we can do both, that there are enough doses to provide these free boosters here at home, and that the U.S. has already donated more than 100 million doses internationally, with plans to increase that to 600 million. Now, coming up at 6 o'clock, how will this rollout work here in the Chicago area? Will we need to reopen large mass vaccine sites? And we'll have reaction from the public on this announcement today. And one other important note, for those who got the Johnson & Johnson vaccine, this does not apply to those individuals yet. We should find out about that soon, but right now this is just for those who had Pfizer or Moderna.
Still a lot of questions to answer. Okay,
yes.
Thank you so much, Dana.
Well, the number of new